Hello everyone. So, are you ready to know about must-know pharmacology tips from the point of NCLEX examination? So, let's go. At first, you need to know about antibiotic administration. In order to know about this antibiotic administration rules, you must remember about Medicate. Medicate stands for M stands for monitor for superior infection, E evaluate renal and liver function, D diarrhea management, I inform if taking any other kinds of medication in order to determine the interaction, C for culture before forceps. Always remember you must send culture before starting the antibiotics. Say no for alcohol. T. You need to take entire course. E. Evaluate culture, WBC, CRP, and temperature. During the NCLEX examination, most of the time they ask about the nursing priorities during antibiotic administration. So you must remember about this Medicate. In next slide, I have included about the conversion. You need to remember this because most of the time they ask about the conversion of drugs, conversion of intake. So you need to remember this. Others know that 1 liter is equals to 1000 ml, 1 teaspoon is equal to 5 ml, 1 tablespoon, that is big spoon, is equal to 15 ml, 1 ounce is equal to 30 ml, 1 ounce ice is equals to 15 ml, 1 kg is equal to 2.2 pound. During the NCLEX examination, most of the time they ask you question in kg and they ask you to convert using the pound formula. So you need to remember about 1 kg is equals to 2.2 pound. 1 pound is equals to 16 ounce. 1 gram is equals to 1000 mg. 1 mg is equals to 1000 mcg. You need to remember this by heart. So do not forget to remember this conversion. Similarly, you need to know about short form 2, and those are PO means per mouth, BID means twice, TID means thrice, that means 3 times a day, QD means once a day, PRN means as needed, HS means hour of sleep. Similarly, I have kept certain mnemonics regarding early sign of digoxin toxicity, which is very important during the NCLEX examination. Most of the time, they ask you about the digoxin toxicity, so you must remember this. Just remember bad ban. The digoxin toxicity early sign bad ban. Bad, that means bradycardia or tachycardia, anorexia, diarrhea. Ban. B for visual disturbance, A for abdominal cramps, and for nausea and vomiting. Similarly, corticosteroid side effects. Remember, there are 5 S of corticosteroid side effects, and those are sick. Those who are under corticosteroid easily get sick. They usually become sad. There is increased in libido, that is S for sex. S for salt, that is written more sodium. So that will lead to weight gain, rise in sugar level. So you must remember the 5 side effects of corticosteroid, and those are sick, sad, sex, salt, and sugar. Similarly, antidote. These are also the most common type of questions that are asked during the examination. Acetaminophen, antidote is acetylcysteine. Benzodiazepine, we use flumazenil. These we use digoxin. For cyanide poison, we use methylene blue as an antidote. Similarly, for ethylene poison, we use fomepizole. For heparin and enoxaparin, protamine sulfate is used as an antidote. For iron, we use deferoxamine. For magnesium sulfate, we use calcium gluconate. For narcotics, we use naloxone. For warfarin, vitamin K is used. For lead, sosumar is used. So you must remember about this antidote. This is very important during the examination. Similarly, you should also know about the drugs that drugs to disease. that leads to potential interaction. And so there are certain drugs which you need to avoid during certain types of disease condition, and those are enlisted here. And those are asthma. We need to avoid the drugs like beta blockers because it lead to bronchospasm. For chronic liver disease, warfarin should be avoided because it leads to increase in sensitivity and bleeding. In case of epilepsy, TCA, anti-malaria, and antipsychotic drugs need to be avoided because it causes reduce in seizure threshold. Similarly, in congestive heart failure, you need to avoid NSAIDs and calcium channel blocker because it leads to sodium retention, increase in risk of cardiac event. Similarly, in congestive heart failure or chronic heart failure, you need to avoid steroid, especially prednisone, because it leads to sodium and water retention. In case of hypertension, you should avoid NSAIDs because it causes sodium retention and increase in blood pressure. In case of Parkinson's disease, you need to avoid COX-2 inhibitor, which is also known as naproxen. It worsens symptoms of Parkinson's, so you need to avoid these drugs. In case of renal failure, you need to avoid NSAIDs because it causes nephrotoxicity. Similarly, in case of respiratory failure, you need to avoid neuroleptics, which is also known as opioids because that lead to respiratory problems, and it may complicate the case and patient condition. So this was for today. If you have any queries or if you want any kind of short videos regarding the NCLEX tips and tricks, you can comment down. Stay updated on my page so that you won't miss any kind of updates. Thank you so much.